My name is Jim Gerstner, and I came into Illinois Cancer Care in 1979. Dr. Cullinan and I have known each other for a long, long time. Dr. Cullinan's father and my father were best friends. We grew up together, knew each other always, and ended up at the Mayo Clinic really by chance. We had both been training under a fellow by the name of Dr. Charles Mortel up at Mayo's, and Dr. Mortel was the head of oncology at Mayo Clinic and was very forward thinking, and that as many of us came from the area, would probably likely settle back in the area, which meant there would be fewer and fewer people coming to Mayo Clinic because they were going to be cared for in their own community level. Realizing that, he said, we need to have more patients involved in research in order to be able to do timely research, and brought up the possibility that a group could be started that would have patients that would come from the area, not just Mayo's, and take that and put that all together into a community cancer program. Those kinds of abilities to be able to have cooperative studies meant that many of the drugs which were previously only available in research centers became available in this research center. The outstanding part, as I look back on my career, was in the mid-'80s when, at that point, the only treatment for colon cancer was surgery or some radiation in situations that were beyond surgical ability. Dr. Mortel had special interest in colon cancer and put together an old drug, 5-fluorouracil, 5-FU, and a new drug that was one that was used in Europe to kill worms in veterinarian clinics, and found that the combination of the two seemed to have an effect in the test tube against colon cancer. We became involved in that early study, and that Peoria contributed almost a fourth of all of the patients in that study. That was the first study to show any effect on the ability to protect colon cancer from coming back in patients who were at high risk.